Hi, this is an OSCE Station video, and today I'll be taking you through a digital rectal examination. And so here's our patient. Hi, my name is Karan Rajan. I'm a fourth year medical student here. The doctors have asked me to quickly examine your back passage. Would that be okay?
Yeah.
Okay. So could I begin by asking your full name?
Henry Jones.
Okay, and your date of birth?
1st of April 1940.
Okay, and so that will make you how old?
72.
Oh, okay, you don't look a day over 21.
Everyone says.
Yeah, sure. So have you ever had this examination done before?
No.
Okay, and do you know why you're having it done?
I'm not too sure.
Okay, so if I could just ask you a couple of questions. Have you noticed any change in your bowel movements recently?
Yeah, there has been a change. That's the reason I'm here.
Okay, and any sort of changes in your stool at all?
Yeah, I've been getting some blood in my stool.
Okay, and you've already discussed this with the doctors before?
Yeah.
Okay, so just quickly about the procedure before, I'll be asking you to be undressed from the waist downwards.
Okay.
And take up a position on the bed on your left hand side, lying down in a sort of fetal position with your knees tucked up to your chest.
Okay.
So before this, would you like to have a chaperone?
Yes, please.
Yes, okay, that's fine. And we'll arrange for the nurse to come in and be a chaperone for this. And you've got a gown there as well, so I'll leave the room and you can get dressed in your own time.
Okay.
And so have you fully cleared your bowels before this?
I did, yes.
Okay, and are you in any pain at the moment?
No.
Okay, is there anything you'd like to ask me?
No.
Okay, so and finally, so when you're in that position, I'll be passing my index finger into your back passage and examining the structures within your back passage and any surrounding areas as well, looking for any abnormalities, and then I'll report my findings back to the doctor. Okay, have you understood everything that I've said?
Yeah.
Okay, if you don't have any more questions, please feel free to get changed. I'll just step outside, and when you're done, just give me a shout.
Thank you.
Okay, now for the second part of the examination, make sure you have all the essentials ready. So you've got your lubricant gel, and you've got your gloves as well, and so you're ready to examine the patient. Okay. Okay, and so make sure your patient's in the correct position, in the left lateral position, with his knees tucked up to the chest, and make sure the patient is fully covered to respect his privacy. But once you've got your gloves on, then you can begin the examination. So before the gloves, make sure you reach over to the hand gel, wash your hands. Okay. Okay, sir, so I'm just going to put my gloves on and I'm going to begin in a second. Okay, so I'm just going to lift up your gown, sir. Okay. Okay, so before you begin anything, once you've got your gloves on, have a full inspection of the anus and the surrounding structures. So just begin by looking there. So I'm just having a quick examination of the surrounding structures, sir, and we'll move on in a bit. So, and remember to separate the buttocks and take a look at the anal canal as well. And notice any abnormalities such as warts or any skin tags or any rashes. Okay. And then proceed to placing some gel on the finger. Okay, sir, I'm now going to be putting my finger through your back passage, and it's got some gel at the end of it, so it may feel slightly cold, but if you feel any pain or discomfort at any point, please let me know. Okay, so I'm just placing it at the edge of your back passage. So place your finger with the gel at the edge of the back passage just to let the anal sphincter relax, and then warn the patient before you enter. Okay, sir, I'm just going to be putting my finger into your back passage now. Okay. If you feel any discomfort at any point, please let me know. So obviously warn the patient before, and in a 360-degree motion, sweep around the passages of the rectum and feel for the prostate. So pronate your wrist and feel for the prostate and any abnormalities in that structure. Okay. And please, could you now bear down on my finger for me? And could you squeeze my finger as well? Okay. So you do that to check if there are any abnormalities in the lining of the rectum and to assess for the anal tone as well. Okay. And I'm going to be removing my finger now, sir. Okay. Okay, so once you withdraw the finger, examine your finger for any findings, any mucus or any blood or anything else abnormal on the glove. And once that's finished, you can just throw away the gloves into the bin. Okay, and that will complete your examination and just finish off with the patient. Okay, that concludes my examination. I've left some towels here for you to get dressed and clean yourself, and I'm going to report my findings to the doctor, and I'm just going to leave the room for you to get dressed.